All right, let's get started. Thank you all for joining us today for this webinar. This webinar is an introduction to the Gateway to Global Aging Data. And in it, we'll talk both about kind of the web resource that we built called the Gateway to Global Aging Data, but also this set of sister studies which are conducted around the world, commonly referred to as health and retirement studies. Again, you're welcome to interact if you didn't hear this earlier anytime throughout the webinar. You can do that by typing something in the chat, by asking a question in the question box, or by raising your hand and I can unmute you. So let's begin. The Gateway to Global Aging Data is a platform for population survey data on aging around the world. It's a free public resource designed to facilitate cross-national and longitudinal studies on aging using the family of health and retirement studies around the world. It's available at www.g2aging.org. And throughout this webinar, we'll also be using the website. So you can see the website here on your screen. So this is g2aging.org, and this is our landing page. And we'll be walking through different parts of our website today. So first, let's talk about health and retirement studies. So starting in 1992, out of the University of Michigan, a study was started called the Health and Retirement Study. And this is a longitudinal study. Longitudinal means that they continue to interview the same people year after year. The HRS is conducted every 2 years, and it's conducted looking at anyone who is older than 50, so 51 and older. And they come back to that person every 2 years and they interview more about them until the end of life. So after the HRS started, it's also a national representative sample. After the HRS started, a similar kind of a sister study started in Mexico called the IMHAS. And then a study called ELSA started, which focused on England. And you can see more and more studies have continued to kind of be added to this network of studies. And one of the ideas in having this network of studies is that you can compare aging and retirement in the older life process between different countries. And so this network of studies, they agree to as much as is possible to ask questions in similar ways in different countries. And this really allows for people to study cross-national effects. And of course, that includes the effects of all these natural experiments of different diets, of different policies, of different environments that happen between different countries. So we'll briefly go over the rest of these countries. So SHARE is a survey of health, aging, and retirement in Europe. SHARE includes 20 European countries currently and Israel. Korea has a study called CLOSA. The IFLS is a study in Indonesia. JSTAR is the Japanese study of aging and retirement in Japan. SAGE is a multi-country study which is conducted by the World Health Organization that includes Russia, Mexico, China, Ghana, South Africa. The Irish longitudinal study of aging is called TILDA. The Costa Rican study on longevity is called CORELLAS. China Health and Retirement Study is called CHARLES, and the longitudinal aging study in India is called LASSI. And LASSI is a study which we help field here at our center at USC, and we are currently in the field now for baseline, so there's not a full wave of data yet available for LASSI. There's also a lot of other studies which are currently kind of in the startup phase, have just collected data but haven't released it yet. This includes Brazil, which will have some data coming available from a study they called ELSI. Northern Ireland also and Wales have studies all coming along. So some of the key innovations of these studies are that they're multidisciplinary. So what that means is that these aren't just studies about health, they're not just studies about demographics, they're not just studies about economic measures like income and wealth. These are studies which try to capture many different aspects of people's experience and environment. Because of course that we know that looking at aging, there are many different causes to aging, and so you want to be able to capture as much of someone's life experiences as possible. There's enhanced quality of economic data. So one of the problems with studies that collect economic data is that often you get high levels of non-response. And this non-response is bias, meaning it's not equally distributed. So often people who have more money or a more complicated financial situation are more likely to, when you ask them the question of, well, how much do you have in stocks and bonds currently? They might say, I don't know. Of course, if someone doesn't have any stocks and bonds, it's quite easy to answer zero. So that's part of this non-response bias. So starting with the HRS, they started using unfolding bracket questions. So at the point when a respondent says, I don't know how much I have in that account, the HRS then starts a bracket question sequence, and they would say, well, is it more, less than, or about $10,000? And if the person says, well, it's more than $10,000, then the HRS interviewer might say, well, is it more, less, or about than $100,000? And they might say less, right? And so now that we know that that value lies between $10,000 and $100,000. So we have some range then on the true value, which the interviewer is not able, or which the respondent is not able to give us the true value. And what this allows for is for researchers to impute here a value. So it's to give a value in a way that you can still include that person in your analysis, but you can have a value, you can assign them a value which is closer to the truth. There's also integrated biomarkers into social surveys. So most of the things that we talked about so far are kind of social dimension, things like health and retirement. But these studies also take real health, physical health measures. These include blood pressure, things like height and weight. They do a number of different tests to test people's physical ability, and they also collect blood. Two of the studies actually also currently connect, they do a full genome sequence, that is the HRS and ELSA, and they have genetic data available for research. As I mentioned here, kind of the core content areas which are covered generally by every single one of these studies. So these includes demographics, health services, work and employment. Of course, these studies are designed kind of in how they're set up age-wise to capture people, who are working, and then as they transition into retirement. So that transition into retirement is important to be able to capture and identify. So the type of work they did, what was their pension system, what are they responding to when they decide about retirement? Is it something that they wanted? It's something that was kind of forced upon them. There's a whole host of economic questions. And there's also questions about family structure and social network. We know those are so important for health and longevity of people at all ages. So as you can see, there's a multitude of different types of survey questions and questions within each of those types. There's a lot of different surveys. As I mentioned, these surveys are generally conducted every 2 years, meaning that, so for the HRS, which was started in 1992, we've got something like 14 different waves of data. A wave is, you usually have a baseline, and then your first follow-up is called wave 2, and then wave 3 and wave 4. So there's a lot of data. So we designed the Gateway to Global Aging Data to kind of be a central resource for anyone who is looking to start using these data sets, particularly using them cross-nationally or longitudinally. So on the Gateway, we built several different tools. So this includes a library of all survey questionnaires. So flowcharts, which illustrate survey skip pattern, which can be quite important and sometimes hard to understand. Concordance Search, so you can easily find things inside of a survey that are relevant for your research. We built interactive graphs and tables, so you can generate some statistics from these data themselves. Documentation of cross-study and longitudinal comparability, because of course not everything is asked exactly the same way in every study and every year. So we really try to identify for researchers what are those differences if they exist. We've also built a catalog of publications based on HRS family surveys, so you can see what other people have already published using this data sets. And we've built harmonized data sets, and the harmonized data sets are really user-friendly data sets, which are a subset of the entire data for each study, but it's one file. It's very user friendly. And we just had a question from Nancy. She said, is race, ethnicity included in demographic questions? Is sexual orientation, gender identity beyond male and female included? So it really depends on the study. So for instance, for the US, for England, race and ethnicity is most certainly asked. For countries which might be more homogeneous, like Japan, sometimes it's not asked, or it's not asked in JSTAR, for instance. And then sexual orientation and gender identity. I think sexual orientation is just starting to get incorporated into these studies. In particular, both Elsa and Tilda had an entire kind of questionnaire about people's sexual activity, and that included questions about sexual orientation and also beyond orientation sexual activity. And those are really interesting. I think that's something people are starting to research more about. So if that's what you're particularly interested in, I would look at both Elsa and Tilda. And as far as gender beyond male and female, I know that for Lassie, which this is a study in India, we do interview trans as a gender option on there. So I don't know to what extent other studies are currently incorporating that. But as that is kind of a historical part of Indian culture, that is an option. We do have trans people who identify as non-male and non-female included in the Indian data set so far. That data, though, will probably not be available until probably mid or late next year. But I hope that's helpful. All right, so let's go to the website, and you can kind of see these different tools which I built. You can access them here through this top bar. So let's start by looking at at just the survey questionnaires. So as I mentioned, we kind of we catalog all of the survey questionnaires. So you can see here, these are links to every single wave. Again, a wave is this kind of repeated next 2 years version of a survey. And then you can see we have by countries here. So we start with the HRS and we go all the way through Lassie in India. We also have a study overview tab. And this study overview tab is really helpful for highlighting things that might be different about the survey design itself. So for instance, you notice that the age eligibility for HRS is 51. But for CLOSA, the Korean study, it starts at 45. They interview people 5 years earlier, or 6 years earlier in this case, than the HRS study. Most of these studies include they include spouses regardless of age eligibility, but this is not always true. So you might notice also for CLOSA, they only interviewed the spouse if the spouse met the age criteria. But for the HRS here in the United States, you know, if one individual in a couple was 60 and their spouse was 40, the 40-year-old, because they were the spouse of the 60-year-old, would be interviewed also. And there's some other information which is quite helpful for comparing things which you might not pick up in just using the survey data themselves. So the gateway provides detailed information about all parts of the survey. This includes the location of all survey items inside the module, inside the interview, survey questions, including question text, interviewer prompts, and answer types and choices, how the question was asked and to whom. Not all questions are asked to everyone. So especially some questions are considered a couple level or household level, and it maybe wouldn't make sense to ask both people the same question. This question's assets are often considered couple level. So usually one person in the couple will be asked, well, how much is your house worth, and do you own your house? Instead of asking both people that and maybe getting conflicting answers and increasing substantially the length of the survey time. And we also include links to microdata variables and how those values are formatted. And what I mean there by microdata variables is what we really have is an index of the survey itself, the questions in the survey. But where that data is stored in the data set is what we call the microdata variable. So we let you know what the name of that variable is, which stores the information related to that survey question. So let's look at an example of that. So for instance, let's say we're considering using SHARE, that European survey that has so many countries in it. We could look at Share Wave 2, which was conducted in 2006. And you can see here surveys are generally sectioned off into modules, which are generally topical. So you could go into here the BH, or Behavioral Risk module for Share. You can see here all the module items which are included to Share, and we can just go into this first question. So this little index here lets you know this is a question, this icon. So you can see this is a question. The question text is, the following questions are about smoking and drinking alcoholic beverages. This is because this is this first question in the module. Have you ever smoked cigarettes, cigars, cigarillos, or a pipe for a period of at least 1 year? You'll notice that this is in English. Share is actually, I think, not in any country is conducted in English, but everything is translated on this site into English. If you were more interested in the original language, we'll have links and I'll show you where to get some of that original language documentation. So the answer type is enumerated, meaning they have some choices. The choices are yes and no. We let you know that a yes is stored in the data set as a 1, a no is a 5. This isn't consistent between all studies. That associated microdata variable is BR001 _. So if you have this shared data set, that's where you would look, you could tabulate, or you could use that variable to find the answers to this question. And you also can see we have these concurrent items, which is helpful because this gives you exactly that question at other interviews, because again, this is longitudinal, so these are repeated questions. So if you quickly wanted to see if this question was any different, for instance, when they asked it in 2014 in Share's latest available wave, you could quickly link to that. And there's also a codebook view, and this kind of gives you one page that has all the questions in the module. And this can be quite helpful if you just want to print this out or use this itself. Another nice thing about the codebook view is it gives you indications about the survey skip pattern, and I mentioned that earlier. So survey skip pattern is a way that surveys use so that you don't ask people questions which don't apply to them. That tends to not be great either for the interviewer or the respondent themselves. It takes up a lot of time. So for instance, in this case, we know that if you answer this ever smoke daily question yes, then you can see that you could ask this next question, but if not, you would skip this next question. And you can see that here in the codebook view, but you can also see that in the flowchart view. And it's much more it's easy to kind of visualize here in the flowchart view. So you can see here is this first question which we get asked, which has an answer yes or no. If the person says, yes, I do smoke daily, then the next question they get asked is, well, do you smoke at the present time? Yes or no? So if they answer that they had never smoked, of course it wouldn't make sense to ask them, do you smoke daily? And they get skipped down out of a bunch of questions about smoking until something else. All right, so that's important to know because, for instance, if you want to build an indicator of whether you smoke at the current time, you need to account for both these questions. Account for both the people who weren't asked the question because they never smoked, and you want to account for the people who have smoked and are currently smoking, and the people who have smoked but aren't currently smoking. So these flowcharts can be quite helpful. And as I mentioned, we built kind of a search function, which we call Concordance Search. And this can be really helpful because instead of kind of going through as we did here, going through, well, I'm interested in Share and I'm interested in, I know it's in this year in this module. Perhaps you don't know that for all these studies, which is quite understandable. So we built a search. So for instance, let's say you were interested in a height variable. You were doing some analysis and you thought height might be important. You're looking currently at China, so you'd be using Charles. You can see that we have information for Charles for 2010 and 2012. So you could click on 2010 and just click search. And what you're going to get there is all these questions which relate to height. So you can see there's several different types of height. We have a knee height. We have some other questions about did the person understand or not, why they didn't complete. And these are all in the biomarker section, biomarker module. and you could link to any of these from there. I also mentioned that we have these harmonized data sets, and these are designed to be consistent between how the data set is set up and organized, and how the variables are named and labeled is consistent for all of these studies. So for instance, let's say that we were using a harmonized data set and we wanted to find a variable. So for instance, we could select harmonized ELSA for England, harmonized share. You'll notice that we only get the year options available, which are available for the studies that we're both interested in. Let's say we're interested in 2006. So that is, I think that's wave 2 of share, wave 3 of ELSA. And let's say we're interested in getting a variable for the number of children. So once you use a harmonized data set, you can then select through all these different options down here, and these are harmonized measures which are created. They're not all listed here, but many of them are, and we can click search. So what we're going to get is the names and informations about the variable inside of these data sets. So you can see from the harmonized share, we have a variable called H2 child. I'll explain a little bit more about the variable naming convention, but this is a household level variable, meaning it represents a couple. It's in wave 2 of share, as I mentioned, and it's a child. You can also see that we also have variables about sons and daughters if you're interested in breaking those down. And then from the harmonized ELSA, we have a similar variable, R3 child. So that's a respondent level variable. It wasn't asked as a couple in ELSA, and it's the number of children. And so this is a great place to start to find variables. We've also built a lot of documentation. And as you might have already kind of noticed, things can be a little bit different between different studies. And so this documentation is especially key for doing cross-national or longitudinal research. And we built domain-specific comparison tables, which are kind of broad overviews of kind of the similarities and differences between different studies and between different waves. And we built domain-specific user guides. And the domain-specific user guides are really in-depth looks for different research domains or topics of all the questions which are asked by every study inside of that domain, how they're similar, how they're different, how people overcome some of those differences to be able to compare things cross-nationally or longitudinally. All of the documentation is available using this documentation tab here at the top. You can see here, these are our domain specific comparison tables. So for instance, if we were interested in looking at cognition, we could click into this cognition comparison table. So one of the things that you'll see is that here on the top we have immediate word recall questions, which is a set of questions which is read to the respondent, and then the respondent is asked to repeat them both immediately and a little bit later in the service, so delayed. And you can see some differences here between different studies. So for instance, the HRS uses 10 words for the immediate word recall. MHAS uses 8. CLOSA and Corellis, the Costa Rican study, only use 3. So this is a great place to start looking for cross-country or longitudinal comparability before you get started, because those differences do exist and you want to be aware of them. We also have links here to a working paper series. So for instance, let's say you were interested in income or wealth or cognition or any of these topics, and you wanted a really in-depth report of how they're different between these different studies. This is kind of a place to go. It's much more thorough than just a table. There's a lot of text and discussion. A lot of time was spent building these. We've also built interactive graphs and charts, and these kind of allow you to get an idea, to get some population estimates from these data sets without downloading the data yourselves and generating them. Of course, you can't generate everything. There are limits to what we allow you to do, but some of the benefits of this is that you don't have to download all the data first. Maybe you can get an idea of how things might be changing over time or between different countries, just by using these interactive graphs and tables that we've built. And the nice thing about these is we've already accounted for the survey weighting and survey sample design here. So these are population estimates, not just estimates of our sample. So you can see here we have graphed total family income for England. This is in 2004. And we've graphed it over 3 different age groups. And you can see that income distribution looks different in different age groups, which you might expect as people move from a more wage-based income to kind of a more pension or investment retirement account-based income. Here's a graph that we also built, and this is whether currently working in pay. We've subset this to only consider people between 55 and 64. So people, we would often, at least here in the US, consider these are working age people. And we've generated statistics here for China, Japan, Slovenia, Sweden, England, and the US. And you can see some really extreme differences in the percent of people who are currently working. So for instance, it's less than 25% of people aged 55 to 64 in Slovenia are estimated to be working, while more than 75% of people in Sweden aged 55 to 64 were estimated to be working in 2010. So you can get an idea of just some of the extreme variation you get by using different countries. And of course, whether someone is working or not has a lot of impacts. So in this case, comparing Slovenia to Sweden might give you some information about the impact of having people working or not working. We also provide tables. So for instance, the tables give you, this is the net value of primary residence. This is over from 2000 to 2012. This is using HRS data because we're talking about the US here. One of the things that you can see here is the impact of the housing crisis here in the US, which occurred in roughly 2008. But you can see both in the median and the weighted mean here that housing prices really continued to rise in 2004. 2006, they fell a little bit or stayed generally the same in 2008, and then 2010 and 2012 they have continued to drop. Of course, here in the U.S., a lot of people have stored their retirement wealth in housing wealth, so this is kind of strongly affects people. The interactive graphs and tables, again, you can just get through the top here by clicking graphs and tables on the website. And we could generate more tables or graphs. You can see here, here are all the different options that we currently allow you to graph. We do have a new version of the graphs and tables coming. Hopefully it's going to be available in a month or about 2 months. Which is going to work quite a bit faster and have more options available. So we're excited about getting that released. And all of the graphs and tables are available to be downloaded in a number of different formats. We just ask that you cite us. The citation information is included here. Let's talk about our catalog of publications. So sometimes it's really helpful, especially when getting started on a research topic or a study, to know what else has been, what this data set has been written for or used for, and kind of what do they encounter, how do they overcome some limitations. So we built this catalog of publications. Users can find publications based on health and retirement studies around the world which are relevant to their research focus. So for instance, here on our publication tab, which is right here, you could say, I'm interested in looking for papers which are using, let's say, IMHAS, the Mexican data. And I'm looking for, I want to write about cognition. So you can see here all the papers which are related to cognition and IMHAS that we've been able to find. We kind of scan through different online databases and identify those papers coming from these data sets. For each of these, you can find a link, a direct link to the paper if it's available, or a link to Google Scholar so that maybe you can get access to that direct paper through your university or institution. You can also search by title if you know a title, or by author, and limit maybe your search criteria by source or by year. And for any of these, you could highlight, for instance, multiple papers, and then you can export any of these citations in text, CSV, or EndNote file. So it's a helpful place to get started looking at what other people have done. I will say there's a little lag between papers getting published and getting incorporated here into our catalog. So in general, I think there's, hopefully no more than a 6-month delay. But so maybe the most recent papers wouldn't be in here, but should be anything from 6 months ago to when these studies started should be indexed here. That is our goal. So let's talk about harmonized data. Harmonized data, as I mentioned before, are really user-friendly versions of these data sets. This is what many people come to our website for to use. Of course, they use the interface of the gateway to find questions and publications and generate graphs and tables. But the harmonized data our people find extremely helpful. And it's one of the more time-consuming things that we do here to create these. So we kind of base our harmonized data on the RAND HRS. And if you're not familiar with the RAND HRS, the RAND HRS is a version of the HRS data, that's the US study here, which is wildly popular among researchers because it's very user-friendly. And when I say user-friendly, if the HRS distributes data about their survey, for instance, one wave of data might be spread across like 30 or 40 different files, which have to be changed and merged, and you have to know what level and what variables they should be merged by. And then, of course, that's just for one wave. If you wanted, all 12 waves of the HRS, that's going to be days and days of merging. But so the RAND HRS is a version of the data set, just like all of our harmonized data sets, where all the waves are combined and each individual is one record. To do this, so this is called a FAT file, if you're familiar with that term. We use a variable naming convention, which we try to make quite simple. So for instance, a variable like R1 work is whether the respondent is currently working in wave 1. We include country-specific variable names or study-specific variable names if the variable is not exactly comparable. So for instance, in the harmonized Charles, that's the Chinese data, we have a variable called R1 LBRF or labor force underscore C. And this is the respondent's labor force status in wave 1 of Charles. But labor force is asked, it's one of these questions which is asked really differently in different countries, representing their different kind of employment and institutional arrangements. So it's sometimes you might see a variable with an underscore, whatever the first letter or a few letters of are that study. And that gives you an idea that although the similar information is captured here, it's not exactly the same. If it were exactly the same, if they had used exactly the same categories, the variable in the harmonized Charles would just be named R1 LBRF. We also include spouse versions, which are helpful for anyone who is interested in looking at spousal effects. So spouse versions of most variables are created. So we'll have a variable called S2 work, and that's whether the respondent spouse is currently working in wave 2. And this kind of saves researchers the trouble of doing spouse matching themselves, although the spouse is also in the data set. These data sets are really popular. They have a lot of information, but they don't have all of the information either. We try to focus really on creating those variables which are most comparable between different waves and different studies and are most frequently used by researchers. We're always expanding what's included in these harmonized data sets. So if there's something that you're looking for that's not in a harmonized data set, please let us know and we can think about adding it. We keep kind of a list of user requests to add to the harmonized data sets. But they are subsets. One more option always is that you can use the harmonized data set as a starting point, and you can always merge in other files from the original studies data sets. So for instance, you could get a lot of your kind of standard variables about gender, about age, about education levels, maybe about income and wealth from the harmonized data set, and then you could incorporate, if you were looking for something that's not in there, you could just merge in that variable into the harmonized data set. Let's show an example of how we might make a harmonized variable. One of the advantages of using harmonized data sets is that we account for survey skip pattern. So we see the survey skip pattern, which we saw in share earlier. And let's say we want to make a variable called R1 smoke in. That's whether the respondent smokes now. And as I mentioned, we're going to have to account for this survey skip pattern, or we're going to have a lot of missingness that we don't know how it happened. So for instance, you can see here, we assign everyone who answered no to ever smoke daily, or who answered yes to ever smoke daily, but no to smoking at the present time, to no for 0, 1, and anyone who answered yes to smoking daily and yes to smoking at the present time as yes to respondent smokes now. You'll also notice that we use a 0 and a 1 for a yes and a no, or for a no and a yes, I guess. We use consistent labels throughout, consistent value labels throughout all of the harmonized data sets. So we try to alleviate some of those differences. This is a really simple example, right? We only have to count for one survey skip pattern. This might save you 1 or 2 minutes if you use the harmonized data set. But they also get really quite complicated. So for instance, this is how the Japanese study asks about savings wealth. It's quite complicated. It uses different studies. So to build this takes a lot of time. You have to account for a lot of different survey skip patterns, which tell you different things. You can also kind of see here at the bottom, on this left panel at the bottom right, we have those bracket questions which are asked, and we provide imputations based on those bracket amounts so that you can still include people who maybe didn't give a precise answer, but you know the range of the answer. So this is quite a bit more work than we saw in the first one. This is, I don't know, 1 or 2 to a week, depending on your familiarity with programming of work. And of course, savings is just one component of household wealth, how much you have in a savings account. You also want to account for stocks and bonds, and for people's maybe investment retirement accounts, people's pensions accounts, household wealth. So for instance, perhaps you're not an economist, you're not interested in the different components that people have and each part of their kind of household assets profile. You just think that whatever you're looking at, you might want to control for by wealth because you think that wealth has an influence on it. So using this harmonized JSTAR data set is a great place for you to be able to look at, to have a variable which economists have created and has kind of been validated and used by other people to control for household wealth, even though that's not your main point of interest, and it saves you months of work, honestly, especially if you're doing this for multiple studies. If you're comparing multiple studies or multiple years of JSTAR, this could save really anyone months and months of work. We also provide lots of documentation. Of course, we're doing a lot of work, and we try to be transparent about everything that we do. So each harmonized data set is accompanied by its own codebook. This includes a brief overview of statistics for each variable. It details the variable creation and any assumptions made in the creation. We highlight any differences between waves for this harmonized variable and any differences between this variable and the RAND HRS variable. We kind of use the RAND HRS as kind of our basis for comparison between different studies. And we list all the variables from the originating data set using the creation of the variable. And again, this is part of our personal push towards transparency. So if you perhaps disagree with how we decided to create this variable, you have a starting point of the list of all the variables used. Here's an example of smoking behavior that we saw. This is from the Harmonized Share dataset. This is the codebook that accompanies that. You can see that we have a variable for smoking ever and for smoking now. We've got it for waves 1, 2, 4, and 5 of share. We're adding the 6th wave now to the harmonized share. That should be available by the end of this month, I think, is our goal. We've got respondent and spouse versions of this variable. We include some brief descriptive statistics. These are not population estimates because they're not weighted, but they give you an idea of how the data are distributed inside of the data set. Because these are categorical variables, we'll also include these tabulations here, which let you know about the different categories. So again, if we see a 0 for all of these variables is a no, a 1 is a yes. And then you can also see that we use special missing values, which are available in SAS, Stata, and SPSS, to identify different kinds of missingness. So for instance, someone could have said, I don't know to this question. Someone said I could have refused, or there could be maybe they didn't get this far in the survey or some other issue with why it's missing. So you can identify different kinds of missingness there using these special missing codes. We have some text about how this variable was created. We highlight any cross-wave differences. You can see no differences known here. And then we highlight differences with the RAND HRS. So here we can see that we say in share, respondents are asked whether they've ever smoked daily for a period of at least 1 year. And in the HRS, respondents are asked whether they've ever smoked, regardless of whether the smoking was daily, and not given a definitive period. So they're capturing something a little bit different. In this case, we didn't consider them different enough to change the variable name. You'll notice that the variable we mentioned here in the RAND HRS is the same variable name as we use in the harmonized share. But we want to let you know about this slight difference because, of course, what is asked in share is only going to capture people who smoke daily. But what is asked in the HRS might be if someone smokes occasionally or socially, they would answer a yes. So depending on what you're trying to look at and measure, you might get something a little different. It's really important to be aware of these differences. And then you can see, lastly here, we list all the share variables used. That was from our simple example. Here's our more complicated example from the harmonized JSTAR. We'll just briefly run through this. One of the things that you can see here is that we create a flag variable in addition to just the value variable of the amount in savings. And this flag variable is helpful because it lets you know how this value was obtained. So for instance, if the person gave a value, answered the question, then they'd have a category of 1 or continuous value for this variable. The person could have also said, well, I don't have a savings account, and they would have been given a value of 0, and they'd be flagged here with a 6 or no asset. And then based on how much information they provided in those brackets, if they said, I do have a savings account, I'm not sure how much is in it, we'd let you know how much information was used in the imputation process. And we also let you know if the value was top coded. JSTAR and a few other surveys top codes really high values or really low values if they're negative in their data set as a way to protect people's identity. So it's really important to know if you're using top coded values, and we highlight those here also. We kind of flag those for you. Again, this was a much more complicated variable to create, so there's a lot more how constructed text. And then we list all the JSTAR variables used, of course. Here are all the here's the status of all the current harmonized data files. So the harmonized ELSA incorporates the first 7 waves of ELSA. Harmonized share is the first, second, fourth, and fifth wave of share. We're going to have that 6th wave incorporated by the end of this month. Harmonized JSTAR for Japan, harmonized CLOSA for Korea, harmonized MHAS for Mexico, harmonized Corellis for Costa Rica, harmonized TILDA for Ireland, harmonized Charles for China, and harmonized LASI. We have a version of that which is based on the pilot data, which was collected in 2010 for India. And harmonized data files are either distributed through the gateway, through us, or by the originating study. And in a few cases, the data files are created by you, the user, based on code we provide by the gateway. And how you know how to obtain them is you're going to use our Downloads tab. So back on the gateway website, you could click on Download. You can see here we have for each study, we have links to download these survey data. So if you just want the original data set, this is how you do it. Like the gateway, all of these data are available for anyone who's doing research. They're all publicly funded, so there's no fee for any of these data sets, so you can download them. We also have a link to download the harmonized data set. So you can find a link here to download any of them. You can download the Harmonized Codebooks for all of them here. We also provide this data code, which was used to generate these programs in case you want to see exactly what we did programming-wise. You can download this data code to look at that. And then in the case of the Harmonized Share and the Harmonized CLOSA, they do not distribute the harmonized data sets currently, but you can download the Share's data code and run that data code yourself. If you have once you have the share data set downloaded on your computer, we give you information about that here. So you can run this once and you will have created the harmonized share data set, and you can save that into Stata or convert that into SAS or SPSS. For almost all the other files, they're generally distributed in Stata, SAS, and SPSS formats. So whichever program you're used to using, you should be able to find some harmonized data files, which hopefully are in that format. We do ask people to register. We ask registration because we are publicly funded, which is why we're able to bring this resource to you for free. There's a whole team of people, from programmers to researchers and research assistants who work on this project to provide this resource. And also with registration, we allow you to download things, and it gives us a sense of who's using the data and what are they using it for. Of course, we also ask you if you use any of the harmonized data sets or information or statistics generated from the gateway that you cite us, and we include that information on the gateway. Registering is really simple. Of course, it's free as everything is on the gateway. You just need to enter some brief information about where you're from and what kind of position you're in, whether you're a student or a faculty or researcher, and confirm your email. You can learn more, of course, by just browsing the Gateway to Global Aging on your own. We also have a help desk email, which is really helpful. It's help@g2aging.org. We always try to get back to people within 24 hours, as long as it's not the weekend. So if you have questions about using the gateway or questions about getting started doing some research with these HRS sister studies or a harmonized data set, we're happy to provide feedback or help or guidance or assistance. Just email us. We also have one more upcoming webinar, which I'll tell you about. This is August 16th, and it's an advanced workshop. So it's kind of meant to be a follow-up workshop to this workshop. If you are up very late or very early, depending on if you're in Asia, you can join this. It'll be on August 17th though. And you can register the same place you register for this webinar, which is g2aging.org/webinar. And it's more advanced. So that's going to be really talking about, so I have a harmonized data set. How do I do the work of cross-national comparison? And in this case, we're going to be kind of doing a hands-on analysis using Stata. And you'll just kind of follow along, and you can certainly ask me any questions. We'll talk about things like weighting and survey design and accounting for those differences. Yeah, so that wraps up this webinar for us. I hope everyone enjoyed this. I hope this was informative. Again, I would encourage you to go to the Gateway and start using these different resources that we have on the Gateway to Global Aging Data. I'll now take any questions. If anyone has any questions, again, you can ask a question by typing something in chat, typing a question in the question box, or by raising your hand, and I can unmute your microphone if you have a microphone, and you could ask me that question out loud. But thank you for joining us, and yeah, I hope to hear from you soon.